Today I rise in support of House Resolution 301 as amended to recognize this week, April 11th through 14th, as Black Maternal Health Week. And I'm joined by our colleagues here who, like myself, are also Black mothers. From recent news stories about horrific healthcare experiences from notable celebrities like Serena Williams, to social justice advocates like Erika Geiss, to the silent suffering of the women in our communities whose names we may or may not know, the issue of Black maternal health is an important one. Among the most perilous Black maternal health issues are the high infant mortality rate of infants born to Black mothers and the high instances of Black maternal death. Black maternal death itself is one of the widest of all racial disparities in women's health. Data from the Centers for Disease Control, National Institutes of Health, World Health Organization, and others indicate that Black mothers in the U.S. die.
Members, I'm going to ask your courtesy and your attention, please. Chair recognizes Representative Geiss.
Thank you, Mr. Speaker. Data from well-noted research organizations and health organizations indicate that Black mothers in the U.S. die at 3 to 4 times the rate of white mothers, and that Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women with the same condition. Black women are 22% more likely to die from heart disease than white women, 71% more likely to die from cervical cancer, but 243% more likely to die from pregnancy or childbirth-related causes. And here, in the state of Michigan, according to the Michigan Maternal Mortality Surveillance Project, Black women experienced a pregnancy-related mortality rate of 50.8 per 100,000 live births, compared to 16.6 per 100 live births for white women. And 10% more Black mothers died within 24 hours of giving birth compared to their white counterparts within the same labor and delivery timeframe. Strikingly, the United States ranks 64th in the world for maternal death. Michigan, our very own state, has the 8th highest maternal death rate overall. But for Black maternal death, Michigan is 3rd in the nation. Is for a high rate of maternal death of Black women. That is a travesty. These alarming statistics for Black maternal health cut across socioeconomic status, maternal age, and education levels. These alarming numbers show why it is necessary to not only work to end maternal mortality globally, but to amplify the need for maternal health and rights with increased attention to the state of Black maternal health in the state of Michigan. And while great and immediate attention to prenatal and postnatal health of Black mothers is direly needed, Black maternal health also means the health of the whole woman, physical health and mental health, and understanding the root causes of poor maternal health outcomes for Black women. It means supporting community-driven care solutions, improving prenatal care, and overall maternal health care. It means improving breastfeeding rates and nutrition, and reducing chronic disease and illnesses and comorbidities that adversely impact the health of Black mothers. And it must also be about improving the cultural competency of healthcare professionals and others so that they listen to and hear their patients. It's about addressing the health needs of individuals and communities with a humane point of view rather than a colonial or anthropological one. And it's about amplifying the voices of Black mothers, women, families, and stakeholders, and giving Black women the tools and empowerment to advocate for birth justice, reproductive justice, and health justice for ourselves and our health and the health of our communities, regardless of marital status, sexual orientation, education level, or whether we're urban, suburban, or rural, or identify as JB, African American, Afro-Caribbean, Afro-Latinx, African, or from anywhere within or across the African diaspora. I welcome your acknowledgement of the important work ahead of us on improving Black maternal health, and thank you for your consideration of recognizing April 11th through 17th as Black Maternal Health Week in the state of Michigan, and it is available for co-sponsorship on the electronic resolutions calendar. Thank you.